Okay, shall we start? So this is another important components in the research. Okay, so you need to know what it means by evidence-based practice or evidence-based medicine, how to apply it. So describe the basis of evidence-based practice, describe the importance and limitations of evidence-based practice, and describe the principles of evidence-based practice. So this is under the evidence-based practice that you need to know of. So what does it mean by this evidence-based practice or evidence-based medicine? So this one is based on the research way back in the early of 90s. So they come up with this evidence-based medicine is the integration of best research evidence with clinical expertise and patient values. Means that when you are treating a patient, you need to put all these elements into consideration in your practice. So being a doctor doesn't mean that you only need like you in these preclinical years, you only learn on the basics of the knowledge. Okay, what is the pathogenesis, pathophysiology, how you diagnose patient, and then in clinical years you learn on the skills. Okay, how to what are the steps taken for you to diagnose the physical examination, and what is the best line of treatment. Okay, so those are the things that is under knowledge, which means the clinical expertise. But on top of that, on your clinical expertise, on your skills and all that attitude, you have to include in the best research evidence and take into account your patient's value and preferences. Because patients nowadays, they are well educated. Okay, like you see nowadays, they talk about vaccine, and we have some anti-vaxxers. Okay, so if you are not well educated to educate your patients, so that might be a problem. And patients nowadays, yeah, they tend to Google. So Google tend to be very misleading. I mean, like the sources are not from the primary source, and we don't know whether the source is reliable. So this, you need to know how to educate your patients and to advise on the best way in treating your disease. Just like cancer, okay, cancer, there are no cure, but there are thousands of products out there that claims that it can cure cancer. So you need to be well educated and use this evidence-based medicine in order to advise your patients on the best way to treat the cancer. Like some patients, they might say, "Oh, I just want to take some supplements that could that claim from the testimonies or whatsoever claims that could cure cancer." So use your clinical expertise and the evidence-based medicine. So this evidence-based medicine is based on the research. So you need to have a strong background research in order to educate your patient. Doesn't mean that you need to do the research. It just means that you need to read more from the publication. Okay, so basically it's just the use of current best evidence in making decisions about the care of individual patients. Okay. So this is what I explained just now. So not only your knowledge, evidence, skills, and all these attitude are important in making a clinical decision. So all others are important. And to take into account on the attitude wise, there's no conflict of interest. We know that nowadays some doctors are doing like sideline business, like supplements. They are promoting supplements to the patient. So that is also conflict of interest. And another example of conflict of interest, meaning that probably there are some new drugs that you want to test. So this drug company approach you saying that if you use this in your patient, try this your patient or buy this medication, so I can give you like 20% commission, something like that. So there is conflict of interest, and that is also a serious breach of ethical issues. So there is also part of the attitude. So as a doctor, you can never abuse your power as a doctor to influence your patients or to take profit from your patients. Okay, so that's on that. And then you have to make sure when you make the clinical decision, your clinical or the health clinic has the proper equipments and the funding. Let's say you want to try these new medications, but your clinic didn't have the enough funding to buy this new medication. Same like equipment, okay? The PCR equipment or even the CT scan. You know, CT scan is very expensive. MRI scan. So all those requires funding. So when you make decision on treating or diagnosing your patient, so you have to take into consideration on the equipment that you have and all that. Same like the current situation. So again, I gave example of COVID. You know, as the number of COVID cases increase, the demand of ICU bed or ICU facilities have increased. Okay, so that creates burden on the health system. So the government has made decision on. That's why I think few days back, Tan Sri DG mentioned that due to this lack of ICU equipments, they really need to pick and choose the patient, which one has more survival rate and being put into the ICU. So that is quite sad in that sense. So hopefully the situation will get better, okay, so that we don't have to make that kind of decision. So for the doctors, healthcare, that is a very crucial decision to make. So which is why we try to control the COVID cases, so that our healthcare equipments are able to sustain, okay, are able to treat all the patients without discriminating anyone. Okay, so that's on the equipments and the funding and all. Okay, on the matter of legal issues, okay, like I mentioned, patients nowadays, they are very educated and they know their rights, and you also need to know your rights as a doctor. You know the limitations. In case of even nowadays, if you want to use blood transfusion, or blood donations, there are also already a consent form, okay, that you need to sign. Even vaccination also, okay, if any of you have experience going to the vaccination, you need to sign in the consent form. So this is to protect both parties, okay, the patient and the healthcare from these legal issues, okay. So all these, there are so many things about this legal action. I think by when you go to clinical years, year 3, you will come across all these ethical issues and all these legal issues regarding the all sorts of disease, okay. Because sometimes doctors need to make a crucial decision on patient, but the limitation is this legal action, because the patients can take action on you in case of there's any, they think that there's a negligence on our on the doctor side or on any of the healthcare worker side, even the nurses or anyone in the healthcare. Okay, so when you make decisions, so put into consideration this legal action, and of course the patient's values, concerns, and their expectations. So patients, they expect us to be in making the best decision for them, okay, the best treatment. They will ask for the best treatment and so on. So we need to have the ample knowledge on how to advise them on what is the best way to treat them. If they, you have to see whether that patient in several aspects, in the economical, financial aspect, whether they are able to pay, and then whether they are willing to pay more for a more expensive treatment. Okay, and then on the aspect of availability, okay, whether you can whether they they have the transportation to go to the facility, and then whether they are able to cope with the treatment. This is the concern for cancer patients. Okay, as you know that cancer patients, even though two patients have the same disease, lung cancer, but the prognosis is different. Okay, based on the risk factor, the age, the comorbidities, probably he has hypertension, blood pressure, and all that. So this will affect your decision in making the best treatment for the patients. So usually all these things, tricky part is when you treat a cancer patient, usually. Others, if you are treating like a pregnant woman, okay, you have to take in consideration what are the medications that are not harmful to the babies, and then breastfeed, just like the vaccine, okay, COVID-19 vaccine. Only Pfizer is shows safety towards the breastfeeding mother and pregnant lady, but the rest still we don't have enough data to show that whether the vaccine is safe or not. So these are the things that you need to take into consideration when making the clinical decision. So all these influence, all these warrants you to research more into the paper that are being published, whether there's enough data for you to use to treat or to cure your patients. Okay, these are the rationale, importance. Okay, medical knowledge, accepted practice, change rapidly. Yeah, this medical knowledge or accepted practice, some probably remain the same, like on how you treat a normal fever, just a normal influenza, just normal paracetamol and so on. But probably in a cancer patient, there are more advanced technique into to treat the patient, or probably in nowadays pacemaker, right? Previously, they use a normal pacemaker, but the device is only can be used for like 2 or 3 years. Then it has to be changed. Okay, so nowadays they have come out with a pacemaker that can be used up to 10 years inside the being put at the heart. The reason behind the previous one is the device when it's sort of like corrodes inside the tissue cells. So it is quite harmful to the muscle cells. Okay, so they need to be removed after 2 or 3 years. So nowadays, the device that they use, the elements that they use are not so harmful towards the heart muscle cells. So it can be it can remain there for up to 10 years. So those are the things that you need to update your knowledge in order to treat your patients so that the risk to the patients is much more lower. Of course, the value of research articles are expanding exponentially. So there are a lot of research articles coming out. This is the example. Okay, the value of research articles are expanding. So from the during the early years, there are not so much research, but it doubles and triples, and it's rising exponentially up until now. So there are a lot of research article which you need to keep up in order to up to date with the current technology and with the current knowledge in medical treatment. If not, your patients might not get the best treatment. So that what it means by this is that even in this COVID pandemic, treatments or the way we treat patients last year compared to this year are also different, because we already understand on how or ways to treat the patient effectively or more efficient. So these are the things that are being put into data, and they publish the articles so that all the doctors worldwide can use that data to improve their treatment towards this COVID patient, so that the mortality rate will be decreased. So that's what I mean by this. Okay. Case study shows that literature is being published at a rate where clinicians can't keep up. In 2010, study indicate that there were over 75 clinical trials and 7 systematic reviews published every day in medicine. So at 10 minutes an article, it would take over 14 hours every day to read them. So this shows that there are a lot of articles for the clinicians to keep up. Okay, other than that is professional expectations and patient expectation. Okay, not only patient expectations that I mentioned just now, patient expect you to advise them to give a proper treatment, but also professional expectations. Okay, you are not just working with, you're not working alone. Okay, you have your nurses, and then you have your, probably you are a specialist in a surgical department, and then you also need to cooperate with other department, NS, ONG and all. So they also expect you to come up with the best. Like surgery also, they are expanding quite rapidly. Okay, they have a new devices, like lasers. You don't even need to open up a patient. You can even use laser to treat. So these are the things that as a specialist or as a doctor, you need to read more on the journals in order for you to increase the knowledge on the latest device or equipments that they are being used. Okay, this is also same. Patients are more knowledgeable. Need to dispute or debate if what's being read on the internet is wrong. Okay, I've mentioned on that. And then integrating evidence into clinical practice regularly makes it easier to find and apply the evidences during busy clinical schedules. So when you are already well versed with all this research, with all the knowledge and all, so this at first it might be difficult, but as you practice it, so it might be useful and easier for you during your busy schedules. Those are the importance, and it's also mainly to standardize the treatment for you to give to your patients. Okay, those are the, the positive out of it. So now comes the limitations, or kind of like negative side of it. Okay, the main thing is the commercial influences and reporting bias. This is mainly with RCT, the therapy, using the papers on new medications or new drugs provided by the pharmaceutical company. Okay, the problem is that funded research and publications, these would cause conflict of interest. So some pharmaceutical company, okay, they will go to you and say that, okay, do this research, we will give you all the fundings and all, but please just produce the positive results, for example. Okay, so that is also a conflict of interest. So if the pharmaceutical company wants to test their drugs, the new medications and all, the person doing the research, or you as a doctor doing the research, needs to be totally like unknown to the funder. I mean, like you don't have any connection, as in they are not your business partner, they are not your friends or whatsoever. That what it means by this conflict of interest. You are totally like nobody to them, and then you're just using it to really determine the efficacy of the drugs and to make sure that there is no side effects. Okay, like I mentioned, make sure the benefit is more than harm. Of course, there are few side effects maybe, but make sure that side effects is not that harmful to the patients. And that one is on research, and same with publications. Okay, there are some pharmaceutical company that says that that influence doctors on to write on their medications, but it's false news, something like that. Okay. And the other one, like I mentioned just now, publish only a positive result and the effectiveness of the drugs. Again, this is under the reporting bias. Okay. Well, as a doctor or as a researcher, this breach of the ethical research ethical, you you should positive whatever results that you get. If it's didn't show much of the positive results or effectiveness, so that is your result, that is what you got. Okay. And then if the medication is really good but the side effects is very detrimental, meaning that, for example, there's a drug, it's good in treatment of depression, but it has a very heavy side effects on delusion. Okay, affects delusion. It means that it makes the patients more delusional. So, uh, but that is not being reported in the publication. So, that kind of drugs it is marketed, but then when people treat or using it on the patients, they saw this harmful side effect, so straight away take it out from the market. And another serious thing is that one is only positive result and they didn't disclose about the side effects. But this one is much more serious, data manipulation. This data manipulation means that the drug is not effective, but they claim that it is effective. So this is a sort of a plagiarism. And then the last one, full reports of clinical trials are not published. So I have this example. Okay. This example is oseltamivir. So this medications or drug is being used to treat flu complications. So it's being used in US during the bird flu outbreak in 2006 and the H1N1 outbreak in the 2009. So basically to combat the flu complications. So what happened in this is that the first Cochrane systematic review, okay, please bear in mind that after this I will explain further on what is this all this systematic review, but systematic review is considered as the highest source of information, highest source of reliable information that you can get. So it means that this is regarded as a very reliable source for the doctors to take and use it to treat the patient. But the thing is, with this systematic review, the review was based on one study report summarizing the results of 10 pooled trials, 8 of which were unpublished. Okay, so I mean, out of 10, only 2 published, 8 is not published. So the best thing about this Cochrane review is that authors are required to routinely update their reviews and must commit to respond to any comments posted about the review. So one Japanese researcher, he questioned about this systematic review. So does Cochrane Reviews have access to this full trial data of the 8 unpublished trials? So he questioned these Cochrane reviewers. How can you say that its efficacy is good when it is from an 8 unpublished trials? So can you get access to these 8 unpublished trials? Okay. So what Cochrane Reviews does is that you go back to the author and ask the author to give this data of these 8 unpublished trials. Okay, then in 2012, Cochrane update the publish, okay, the paper. So the regulatory data has been disclosed, but the authors found no effect in preventing flu complications due to incomplete and inconsistent reporting in the trials. So this is the example of this. the full reports of clinical trials are not published. Okay. So because of this unpublished data, and they just based on just two published data which shows a good result. Okay. So these are the things or the downside of some publications. But this is way back in the 2012. Okay, nowadays they have improved. They learn from this kind of mistake. Okay, because systematic review is the highest reliable source, and they don't want to create the same mistake or the same havoc. And so they have been more careful in any systematic review. If there are any unpublished data or incomplete data, they will make sure that the author submit all the full trial reports before it is being published by the papers. Okay. Okay. So far, any question? So I hope you are clear on the concept of this evidence-based medicine. Those are the importance, and these are the few limitations in the evidence-based medicine. Well, this is just an example.
Doctor. Sorry, the Cochrane, what's the Cochrane? Is the organization to review the drugs?
Yeah, the Cochrane is a name of a publication. It's a Cochrane systematic review. It's like PubMed, Scopus, if you're aware, if you are familiar with the publications. So Cochrane is one of the best publication in medicine. I think I have, wait. This is part of the journal in medical field. So Cochrane is one of these journals in the medical field. But nowadays Cochrane is, I think it's changed the name already, but we no longer use the Cochrane, but it has been a standard that we use that in the medical field nowadays. Okay, so nowadays this is the top 10 medical field best journals that we have now. If you are saying about the drug reviewer, the drug reviewer that we have is like in US, the FDA, WHO, and then here in Malaysia, the National Pharmaceutical,
NPRA.
something like that. Yeah, NPRA. Okay. Okay. Any more question? Well, good. At least you're aware about all those. I also don't remember. Okay, so next, you already know about the what are the importance and then limitations. So next, we go to the steps in the EBP process. So there are process in this evidence-based practice, but it's actually the normal practice that if you always do as a doctor, so it will come easy. First of all, of course, assess the patient. Okay, clinical problem or question arise from the care of patients. And then ask the question, construct a well-built and answerable question derived from the case. And then acquire the evidence, select the appropriate source, resource, best evidence to conduct a search. And then appraise the evidence, critically appraise the evidence for its validity and applicability, and then apply it to the patient. So return to the patient and integrate the evidence with a clinical expertise, patient preference, and apply to practice. And then self-evaluation, so evaluate. Usually, after you treat the patient, so patient comes for follow-up, so that's evaluate. Okay, so these are the steps. So the main thing is the formulating the question. So formulating the question will be based on this PICO principle, means that the population of patients, which patient population of interest, and then the intervention. Okay, what is the therapeutic intervention of interest? Then comparator, if there is an explicit comparison intervention, or what is the control intervention gold standard, and then the outcomes. What are the important patient outcomes of interest in result of the exposure? So these when you assess the patient, so ask the questions. These are the things that are required when you are formulating the question. So this one also I will explain further after this. And then after you have come up with the question, so you find from a reliable source. Okay, the sources of publication or journals, like if it's regarding a therapy question, so the ideal type of study is the RCT, randomized control trial. Okay, and then if it's a prevention, RCT is much more better than cohort study and case control. And then if it's diagnosis, you usually find in a prospective study, blinded control trial comparison to gold standard. Usually, we'll find something that is comparison to the gold standard. Like for example, the COVID, um, on how to diagnose the COVID. So the gold standard now is using PCR, and you want to test whether the rapid test kit is reliable, or is there any more false positive or false negative things like that. So you always compare with the gold standard. Same like mm, what do you call that? How the to test the ECG. Nowadays we have the portable ECG. Okay, the so the gold standard for this portable ECG is the usual ECG, the machine, the big machine that you use to test the ECG. So that's the gold standard. Okay, nowadays they are trying to create a device which is more portable and which is more easier for us to carry. So that's the current trends in the technology nowadays. Okay, prognosis. Cohort study is much more better than case control and case series. And then if it's regarding etiology or harm or risk factor, RCT is much better compared to cohort study and case control. If it's a cost analysis, we usually search in the economic analysis. But if there are meta-analysis and systematic reviews when available, they often provide the most reliable source of study. So based on this EBM levels of pyramid evidence, okay. So it means that the highest one, the meta-analysis, if you find a paper that shows a meta-analysis of some studies, so that is a much more reliable source for you to take compared to this. The lowest one is the animal studies or laboratory studies. So if you So it says here when you cannot find cohort study, okay, just look for a case series. So when you look for a study, you start from the very above, find for a meta-analysis. If you cannot find a meta-analysis paper, search for a systematic reviews. Okay, just like just now, the uh, example that I gave just now is on Cochrane systematic reviews. Yes, that is the highest that you can find. But at that time also, there's a reporting bias. So they have tried to improve the system, and nowadays it's becoming more reliable and much more reliable. And we can rely on this systematic reviews publication. But we also need to look into whether the paper publication is from a high impact factor journal or not. That one I explain further. So that's how it is. So if you cannot find systematic review, so you find on the RCT, cohort studies, and so on. Okay. So these are the what do you call it? Explanation on what is a meta-analysis and all that. So this one, I think you can just read on your own. So I don't need to explain further on this. Anyhow, these I think you've learned in the type of study. These are the different type of studies. So more or less is the same. Okay. All right. So index journal. I mentioned, even though you find a systematic review or meta-analysis, you still need to look into whether it is from an index journal. So what is index journal? So index journals are considered to be a higher scientific quality quality as compared to non-index journals. So if you want to find whether it's an index journal or non-index journal, they are always like it will journal something something, then it will say it's an index journal, it's a Scopus index or ISI index. It will mention there, and then it will have the ISI number written there. So it means that it is an index journals. What's so important about these index journals is that they are the main indexes for academic journals. So these journals, they are recognized by the academic institution, meaning that academic institution use this journal um, to either treat the students and also to use it in the studies to teach the students. Okay, just like us, you will see we are using BMJ journal. Most of it is BMJ, this one, British Medical Journal. In your internal medicine, even in surgery, I think, all of them are using the British Medical Journal, so it's good. And some of it is in Lancet, but all of these journal, high impact factor journal, of course, they need to be subscribed. Okay, well, the higher the impact factor, the expensive it become. So the UOC can only afford this PMJ, but I'm not sure now with the current pandemic whether they continue the subscription or not. So this the index journal, it shows the quality of the scientific publication. So you would consider the index journal compared to the non-index. So that will give a more reliable source compared to the non-index journal. Why? Because this index journal, they go through this peer review process, meaning that it goes through a reviewing process by the expertise in the related field. Let's say it's a study on COVID-19, so these papers are being reviewed by the experts in the field of virology, on the field of the public health, so that they can give a valuable input to know whether the study is really genuine or not. They also use the critical place concept in order to ensure that the paper is truly genuine, the methodology is reproducible, and the result data is not being manipulated, and most of the time it is not plagiarized from other sources. Okay, there's no it's an original article. Okay. So which is why during this review process it involves editing and some might be rejected. Okay, it's not an easy process. So which is why index journals are considered as more quality. The thing is, these non-index journals, some of them are just looking for profit, so they just take whatever journals without that are being sent to them without reviewing whether it is genuine, whether it is good or not, reproducibility, whether the method is correct or not. Okay. So when you are looking for evidence, okay, make sure you look based on the EBP pyramid, and also whether it comes from the index journal or non-index, and if you can get it from a high impact factor journal, that is much more better. So these are the high impact factor journal in the medical field. So in other fields like in engineering, in architecture, they also have their own publication and they also have their own impact factor journal. Okay, so these are the things that we always, the journals that we always use in medical field. Although you have become a doctor, as a healthcare worker, as a doctor in a hospital also, they always refer from this high impact factor journal. Okay, once you already got the evidence from a reliable source, so you assess the applicability. So is your patient so different from those in the study that results cannot apply? Okay, some like I mentioned, population. Okay, if the study is being conducted UK. So can it apply here in Malaysia population? Is it the same? And then treatment, intervention, screening feasible in your clinic. So do you have the enough facility? And then what are the potential benefits and harms from this? Yes, of course, these are the main thing. And what are your patient's values, expectations for the outcome you are trying to prevent and the adverse events that might cause with this treatment, intervention or screening. So these are the thing that you need to take into consideration before applying it to the patient. The easiest example I can give is just like the cancer patient just now. Cancers, different patient have a different risk factors, so different prognosis. So you need to come up with the best. So taking into consideration all this, okay, whether you have a ample facility and then whether the potential benefits is more than harm. Okay, chemotherapy, it might be suitable for a younger age, but if it's for the older age, more than 60, is it okay? And different kind of chemotherapy also is quite harmful. For example, like if you use methotrexate is usually used against an aggressive type of cancer because it is effective, but it's also harmful towards the patient's normal cells. Okay, the patients will have more side effects compared to use other kinds of chemotherapy. So which is why methotrexate is being used only in good prognosis patient compared to the bad prognosis. So these are the things that you need to put into account when you assess the applicability. Okay, then of course apply to patient, then evaluate. Okay, so these are the steps in the EVP process. Okay, any question? No question? Okay, so I hope you can, these are the main thing or the main concept that you need to understand in the EBP. Okay, what are the importance of EBP and then the limitations, and then what are the steps, then what are the EBP pyramids, okay, what is the most reliable source, and then what are the steps of that you need to take, all these first assess patient and then ask questions, then acquire evidence, praise the evidence, okay, and then apply to the patient. And last but not least is the self-evaluation. Okay, so that's all on EBP, evidence-based practice that you need to know of. Easy, right? So if there's no question, I'll proceed. Formulate the clinical questions. So formulate clinical questions is based on this PICO concept, just I mentioned just now, and apply these elements to the research designs. So the type of clinical questions, there are two types of clinical questions that you need to know of. So first one is the background question. Background question is just a general question about the illness, the disease condition, process. This typically you ask the who, what, where, when, how, and why. So these are the example is like what are the clinical manifestation of menopause, what causes migraines, how can we prevent COVID-19, what are the treatment of COVID-19. So all of that is just the background questions. The foreground is the specific knowledge to inform the clinical decisions. So these questions typically concern a specific patient or particular patient. So quite often these usually it investigate or compares between two drugs or two kinds of treatments or two kinds of diagnostic. And these foreground questions can be simplified into four major types: treatment or therapy, diagnosis, prognosis, or etiology and harm. So these are the four major types of foreground questions. And these are also the four major types of studies, if you realize. Okay, treatment is on the RCT and then analysis and prognosis. Okay, so for example, is this type of medication increasingly effective when compared with placebo in slowing the rate of functional impairment in a 45-year-old male with Lou Gehrig's disease. So or another example is that pediatric patients with allergic rhinitis, intranasal steroids more effective than antihistamines in the management of allergic rhinitis symptoms. So usually it is comparing between two drugs or comparing between a control. So when you come up with the clinical questions, these are things to take into consideration, this PICO thing. Okay, let's see, these are the principle. The population describe the most important characteristic of the patient and describe who relevant people are in relation to the clinical problem. Okay, and then the intervention usually is a procedure such as drug treatment or chemical or other hazard physical features, or even in a diagnostic test, it's usually the index test, like in the COVID just now. So the intervention, the index test is the rapid test kit. The comparison usually is the describe the main alternative being considered or the gold standard. Like the COVID, you want to compare between the index test and the gold standard. So the gold standard in screening or diagnosing the COVID-19 is the PCR. Okay, so that's the comparison or the gold standard. And then what is the outcome? Describe what you're trying to accomplish, measure, improve, effect. Like in the COVID, okay, the outcome is diagnosing. It's just not just diagnosing, it's reliable diagnose, specific diagnose, true diagnose of the COVID-19 patient, because some rapid test kit give a false positive result. Okay, so which is why they say that sometimes the rapid test kit is not that reliable. So they still go to the gold standard, which is the PCR, which gives a much more specific and reliable. Okay, so yeah. So this is the example. Okay, case one on intervention. So Anita is a 55-year-old woman who quite often travels to UK to visit her elderly mother. She tends to get swollen legs on these flights and is worried about her risk of developing DVT. She asks you if she should wear elastic stockings on her next trip. Okay, so what are the PICO in this case?
The
Patient or
person,
population?
the Anita, 55-year-old woman,
Okay. What is the intervention?
wearing DVT socks,
Okay. What is the comparator?
not wearing socks,
Okay. Outcome?
prevention of the DVT.
Okay. Correct all except the passengers on the long haul flights. So patient or the population. So not just Anita herself, but also all other passengers on the long haul flights. Okay, good. No, so yeah, of course, the clinical question. Usually, clinical questions will sound like this: in passenger on long haul flights, does wearing elastic compression stockings compared with not wearing elastic stockings prevent DVT? So these are usually the way they word the clinical question. Okay, case two on etiology or risk factors. Susan is expecting her first baby in 2 months. She has been reading about the potential benefits and harm that vitamin K injection in newborn babies may cause childhood leukemia. She asks, "Is this true? And if so, what is the risk of her? What the risk for her baby will be?" Okay, so what's the population?
Pregnant mothers.
Pregnant mothers.
They're asking for the baby, so it should be newborn baby.
Oh yeah.
Okay, yeah, newborn baby. So intervention indicator.
Vitamin K injection.
Yeah, vitamin K injection. Comparator.
No vitamin K injection.
Yeah, no vitamin K injection. Outcome.
Leukemia.
Yeah, the childhood leukemia. Yeah, correct. Okay. Yeah, at least you can get it. So from this is just a simple case. So I hope you can, from the paper that that we gave for the critical appraisal. So I hope you come out with all these population intervention or indicator, comparator, and outcome from those papers. Oh yeah, clinical question in newborn baby, does vitamin K injection compared to no vitamin K injection increase the risk of getting childhood leukemia? Okay, third one, diagnosis. There is a hearing check as part of your clinic assessment for other patients. While discussing with your colleague, you claim that a simple whispered voice test is as accurate as tuning fork. Challenge to back this up with evidence, you promise to do a literature search before tomorrow's meeting. Okay, so what's the population?
Elderly person.
Yeah, elderly patient. Index test. What's the index test?
Simple whisper voice test.
Yeah, simple whispered voice test. Then what's the comparator or the gold standard?
A tuning fork,
A tuning fork. And then what's the outcome?
which is more accurate.
Yeah,
The accuracy is
the hearing. Okay, accuracy of the diagnosis. And of course, the question in hearing check for other patients, the simple whispered voice test is as good as the tuning fork. Okay, good. So that's on diagnosis case. Okay, what about this? Jeff, a smoker of more than 30 years, has come to see you to know whether acupuncture is able to help him to stop smoking. So he tells you he has tried to quit smoking unsuccessfully in the past. A friend of his, however, successfully quit smoking with acupuncture. Okay, should he try other way to stop smoking that you know of is nicotine replacement therapy. Okay, so what's the population or problem?
smokers.
Smoking society.
Okay, smoking, smokers. Okay, intervention. What's the intervention?
Acupuncture.
Yeah, okay, acupuncture. What's the comparator or control? Or the gold standard?
Nicotine therapy.
Nicotine replacement therapy.
Yeah, nicotine. The outcome?
Stop smoking.
Yeah, okay, it's good. So I think you get the concept. Okay, that's a very easy case. Okay, any question on this, Pico? So I hope you get. That's the the concept that I want you to understand. Pico, at least you identify on the what's the population intervention and then comparator control and outcome in a different case. Okay, I give you the RCT and then diagnosis and then the risk factor. So try to apply it on the critical appraisal. Or if you read other journals also, try to point out all these things first. Then it will help you to understand the paper better, the publication better. Okay, any question? That's it. That's my lecture. That's all you need to know. Any question?
Doctor.
Hmm?
For the previous topic, for the index, it's being reviewed by the expertise. But how about the non-index?
Yeah, that's the thing. Usually because index journal, they are being controlled by these Scopus and ISI. But non-index journal, we don't know who is the board authority that controls them or that reviews them, because those who are in index, so this corpus journal will usually monitor them to make sure that they are following the research ethics, make sure that all the published papers are true, genuine paper, original paper. Because if they suspect or they find out that these papers are not true, or there are some false data, falsification of data, probably manipulation of data, things like that. So authors usually will be punished, but the publisher also, in a way, will get sort of like a punishment also. So it's like tarnish their reputation. Okay. Which is why in like I mentioned, Cochrane review just now, which is way back in the 90s and 20s, but nowadays they are not so popular anymore because of a few of their papers have that kind of, like, when people question, then only they take the action. So which is why we use usually in our studies, we always take Cochrane as an example, so that the same mistake doesn't repeat. Okay. So which is why it's better if you want to publish, you want to search for journals, search for an index journal, because it's much more, because of this reviewing activity, they are much more reliable compared to the non-index. But there are also in some cases, few cases where this we also find that this non-index journal that I mentioned, because of money, okay, they just publish paper without really reviewing the paper, or probably there's a conflict of interest where, some reviewers also, they, some authors, they pay the reviewers, okay, give me a good review so that I can publish in this high impact factor journal, so that kind of stuff. But they are very minimal, okay, compared to the usual standard that we are trying to achieve now. Okay, well, in any way, there are so many, well, corruptions is everywhere, even in our government. So it's the same in the healthcare sectors, same in this research world also. So corruptions are everywhere. So that's why you need to really have a good attitude, order not to be swayed by this all money and corruptions. Okay, any more questions?
Doctor, can I send the attendance? Hello?
Doctor, can we have the slides?
Hello, doctor, we cannot hear you.